An individual that's dealing with a mental health issue didn't wake up and say, I want to have mental health issues and I want to spend my days in hospital. No different than somebody who's dealing with addiction issues. They didn't wake up and say, I want to wake up with a needle in my arm. These are individuals that, unfortunately had some hardships in their life. As a community, as a police service, you have to do what you can to help everybody within the community. Oftentimes people call police when they have no other phone number to call. The reality is there's better people out there to do the job sometimes. And in 2022, we were the first police service in Canada to roll out a RIST team, which is a rapid intervention and support team, to go deal with the marginalized triangle, which is homelessness, addiction, and mental health. The rapid intervention and support team is a multi-disciplinary team of experts from our community, experts in the field of homelessness, addiction, and mental health, who work together daily in a team-led setting to help those most marginalized in our community. I believe that people that go to school for addiction, get the proper training in mental health and homelessness, they're the ones at the front of the line that can do the job much more efficiently than police. They have the right things to say, they know why they're there, they know what they have to do, and more importantly, the person that they're servicing understands that they're there to help them and get them through the navigation that they need to be successful. You can deal with somebody for the homeless issue, but if you're not going to help them with their addiction or that mental health issue, we're not giving them the proper wraparound supports. And by creating this team of RIST workers, we're able to have those subject matter experts from the community who are proficient in their line of work do the job that's intended for them to do, and not necessarily police, and allows us to do the job of making sure they could do it in a safe environment.
The change in policing to being more social, more human is important, right? Because if you don't have a bond with somebody, they're never going to be able to help you. They might be reaching out, but you're not going to be letting them pull you up.
RIST has been an expansion of the Social Navigator program, the collaboration between police and paramedics. As a paramedic, I don't have all the answers about housing and women's and Indigenous issues, so we brought in different community partners and all work together collaboratively to get all those answers that we need for the clients.
Having partnerships like our organization does is huge. Working with St. Joseph's, CMHA, YMCA, John Howard Society. If I don't know a resource in the community, there's a good chance that one of my colleagues does. So having that in the room where we can ask a question in real time and get a suggestion is just phenomenal to have access to.
We thought we need to enhance our partnerships and bring community partners to work alongside us with emergency services in order to provide the right support at the right time when people are asking for that help. So we know that if we go to the client's environment, it really makes a difference because they're able to connect to those services.
We're going out with the police, we're going out with the paramedics, and we're being able to provide in-the-moment service where otherwise there might be a wait list. So if you're meeting with a client that is homeless and you have the housing worker there, you can do on-the-spot work with them. And if you're meeting a client that doesn't know when their court date is, the court worker can say, hey, or me, can say, hey, I know when that court date is, or I know when you're in next, and we can get them to where they need to be.
One thing I always try and keep in mind in this work I do in general and within the RIST team is that youth deserve a chance to succeed. The difference between working with youth and adults is that youth a lot of the times haven't accessed resources, or if they have, they've done it with the help of a parent or a guardian. And being able to support in that transition I think is really important because there are so many resources they can access that they may not already know of.
This is a team. Everybody has their disciplines and everybody works together. And if something was to break down and I was the only one helping, that would break down on everything else. Every single discipline, like housing, addictions, they have their specialty, and it allows me to focus on what I'm actually here for, which was the mental health.
When engaging with people, building rapport is paramount in building trust and getting someone to believe in you that you can actually help, because there's already historical issues between the Indigenous community and police services, paramedic services. So when they see me working with them, but then when I actually talk to them and explain what I'm doing, that kind of alleviates that barrier a bit, and they're more apt to work with me than against me.
Some of the hurdles that we face in RIST is you are dealing with a very marginalized population, so individuals waiting months and months for the support that they need right in that moment. So you're able to get across those barriers that sometimes other programs may have.
The one thing I would like people to know is like what puts a smile on my face every day. When I sit down with a woman, get to know their needs, and make those calls to community partners, and this client gets the right support. That is a successful day for me.
I'm a huge believer in community first. And I don't think there's a job in this world that you can do without partnership. And it surely goes for the Hamilton Police and policing in general as well. And that's something where I've sat back and seeing these social workers from the RIST team come in and engage with the community and engage with people. When I see something like that, I see success. The reality is these individuals don't have anybody else to turn to. And when they see that you're not a police officer, you're actually a human being. And it's no different the other way around. You're just not a homeless guy. You're just not a drug addict. You're actually a human being. When you can have that rapport where they don't look at me as a police officer and I don't look at them as, whatever their ailment is, it's a lot easier to build rapports and have meaningful dialogue in order to help them and get the help they need.